I'm going to go ahead and get started. Kathy has given me the signal back there. My name is Julia Esparza. If you don't know me, I'm the one of the library faculty. And actually, it says here clinical medical librarian. I keep thinking of myself as that. I'm now head of head of education services and outreach. So I'm going to talk a little bit about using clinical resources that we have. I'm going to talk about several new things that you as faculty or residents may not know about. Hopefully you'll find that very useful. My disclosure, I have nothing, I don't own anything, nothing. So today we're going to make sure that you know how to utilize the internal medicine LibGuide comfortably. We're going to make sure that you know what library services are available so that you can serve your patients better. So, no sleeping. It's going to be very exciting. So, did you know that there are library resources in EPIC? How many people knew that? Raise a hands. Just hands. Wow. Not very many people. Okay. So, let me show you where they are. First and foremost, when you're signed into EPIC, up in the right-hand corner, you can click on Resources, and you will see that there are all these different resources that are available. There's the Ask a Librarian. You can go ahead and click on that, and we will get a form that will come into our email. There's Harrison's, there's ClinicalKey, Dynamed, and UpToDate. Some people say, where's UpToDate? Where's UpToDate? It's under all facilities because every facility has UpToDate. Not all the facilities have Dynamed or Harrison's. All right. Also, when you're in a medical record itself, when you click on over the I, it says Search in Clinical Knowledge Base. When you do that, it will take you to a list of resources. Now, Dynamed comes up first because it's alphabetical listing. So you can click on UpToDate then, if you really want to look at it, and you can look at the same information. So it's tied to the diagnostic codes, the ICD-9 codes. So if it's a upper GI, a COPD exacerbation, whatever, it's going to give you in context clinical information from a reliable resource, okay? Also, if you're in this screen and you're looking at medications, the same thing with the medications, you can click on them and it will link out to the pharmaceutical clinical information resources that we have as well. Okay, so the library website, we did a little bit of a change. I've heard that there's another change coming. We didn't change it that much, though. We just did a little reorganizing. I want to bring your attention to Healthy Links. How many of you know that we, in this department, medicine department with Terry Davis and several other clinicians, created Healthy Links? Healthy Links is a consumer health resource that was created specifically for Louisiana residents. What we've done is we've vetted consumer health websites and tried to pull out the most comprehensive, but at a lower literacy level. Everything that's on this website is geared towards as low as we can find it as far as literacy. All right? So the library faculty and them started this about 10, 12 years ago, I would say. And it's been actively added to throughout the time. And you can notice that you'll see there are issues that we, clinical faculty, have brought to our attention that we've needed to highlight. So here's things about being a smart patient, end-of-life issues, because a lot of patients have questions about that, finding health care, staying healthy. And then these are topic areas that we have developed specific resources for Louisiana residents. All right. And we have this several of my colleagues created this amazing Captain Fit. It's an interactive comic that's for 4 to 8-year-olds. So if you know of any kids, and I just wanted to bring it to your attention because a lot of people don't know that we even have this on there, and it was a very, very big project that involved Dr. Venturi and several other people. But just beware, if you're a med peds, you don't want to make eye contact with him if you could fit into that outfit. Because he was saying, we need to find someone who will be a mascot, who will be Amazing Captain Fit. So if he starts talking about Amazing Captain Fit, run. Because he's looking for someone to be a guinea pig. All right, so back to the library. Now, the big thing that you need to know about is resources. So we have all of your basic resources here. We have your ebooks, your e-journals. We have some that are very specifically and highly used. PubMed. PubMed is the resource as far as finding clinical information that is just released. And it goes back to 1946. It indexes 5,600 journals a year, and there's about 26 million records in the database. It is updated daily, so as soon as a journal publishes something, it gets updated in PubMed. It's instantaneous because the publishers actually load the records now. Dynamed and UpToDate, which I know some of you know about. Dynamed and UpToDate are summary databases that are evidence-based. So they do searches in PubMed, and they do hand searches of a few journals. So they hand search about 400 journals out of the 5,600 the PubMed indexes. And then they do searches, and then they take that information and develop that into resources, the summaries that you see. It does have, both of them have mobile offerings. If you do not have these mobile set up on your phones, go ahead and do it. You need to do it while you're on campus, and then whenever you're anywhere out and about, you can, if you're over at the VA or Conway or wherever you are, you'll still be able to access these resources mobily, okay? Also, if you're faculty and you have it on your mobile device, it will track CME for you. And I believe that you can turn in up to 20 hours of CE a year for online searching. So, and I have, just to give you an idea of how much it gets used, in UpToDate, I have probably 120 hours in UpToDate, just that one resource. So that gives you an idea of how easy it is to create CME with it. Okay, so it's always nice to use these resources, UpToDate and Dynamed, but you know, you always want that extra gold star. You want to be that, get that excellent from those people who are wanting you to use a few extra resources. So let's talk about some other library information. First of all, our hours and holiday schedule is on here. Also, a lot of you come and use the labs, the computer labs, because there's oftentimes you can't find computers upstairs, so you're charting or doing whatever else in the labs. We have the schedule online, so if you want to check to make sure they're open, you can do that. Right now, the lab is closed because they're teaching a class. So that's always good to be able to just pop in and check and look. Ask a Librarian, it has the generic email, which I see and several other of my colleagues see. Iliad, which is interlibrary loan. If you ever need an article that we don't have, you can utilize that. Dr. Todd can tell you all about interlibrary loan. He is an aficionado at it. And off-campus access. Does everyone have off-campus access? If you don't, you need to go in and do this so that you can access all of these resources from home. And you just use your current email, username and password to do it. You download, read the instructions, and download the new VPN F5, whatever they're calling it this week. and then you can access it. It's really, really nice. It just pops on and off, tells me I'm running out of time, and then I go in and I do it. It's a very simple system. And this is what the screen looks like when you sign in the first time. You would if you download the software, you bypass this in the future. Okay? It just goes straight in, and you're signed in, and you don't have to click any of that stuff. Writing consultants. If you're going to do any research, and I've partnered with several of the colleagues here to publish, and we have won some awards for that. If you're planning on writing anything, your resume, personal statement for applying for fellowship, anything like that, they will go through and check it for grammar, clarity, things like that. They are not content experts. They will not tell you if you've made a big clinical error in something, but they will check it for everything else, okay? So now what about the other clinical information? And I was going to replace her face with someone else's, but I decided not to. So, under the resources page, there's a link called LibGuides Subject Portals. When you click on that, you get all of these different resources that could be relevant to internal medicine. So, all of these resources could be beneficial if you're depending on your patient. But we're going to talk specifically about the internal medicine LibGuide. So, this is the main page of it, and you can see up here we have these tabs, and it's all organized. Now, you'll notice something here. When you look at these tabs, you'll notice that I have links to all of the internal medicine co-departments, I want to say, as far as endocrinology, hematology, gastroenterology, all of those different areas. So you can get to those from the internal medicine. So if you bookmark this on your phone or your computer at home or wherever else, you'll be able to get to all of them, okay? Now, on the page, the first home page, I always have the newest books that have come out. So we're starting to already see the 2017 books, which is kind of amazing in itself. And then you also will see things like instant workups. What more could a resident want or a student? That's a brand new book that was just added. We just got that in. And all of these are electronic, okay? Now, many of the same resources that are on the LibGuide for internal medicine were found on the home page of the library. You don't have to go to the home page of the library necessarily. If you bookmark this page, you will get access to all of the things that we just talked about here, okay? Ask a Librarian, Writing Consultants, Iliad, all of those things. So I highly recommend that you bookmark it. So we have new books that you can have listed. Now, what other resources do we have that will help you stand out? So we have fast clinical tools. So we have Harrison's, obviously, right there up at the top. And we have Diagnosaurus, which is a differential diagnosis tool. Visual DX, which is a dermatological differential tool. It is very, very useful if you have somebody with a rash or anything else. Then we have the number one thing that I hear in Morning Report, the Bristol Stool Scale with the cup. If this doesn't remind you to ask patients, I don't know what will. And then we have other resources down here. Fluid and electrolyte, that's always an issue that comes up. Procedures consult, EKGs, plain and simple. So all of these things are in here. The U.S. Preventative Task Force, all of their recommendations are on here. So then I have other selected ebooks. These are ones that are not under the fast clinical tools. So these are things like Cecil's Essentials, Cons. The reason why it's not under there is because it's the 2016. I'm already starting to move things over. The Brocklehurst Textbook of Geriatric Medicine and Gerontology, because we do deal with so many patients who are geriatric. The Scut Monkey, Critical Care Medicine, Essential Clinical Procedures, Evidence-Based Physical Diagnosis, and then it goes on and on, Harrison's ICU book. And then I always get questions, do you have a manual on mechanical ventilation? And so that is, we have a book now on mechanical ventilation. So if you need to look up something, that's a great book to utilize. We have internal medicine journals. Remember, the journals that are specific to a specific discipline, such as gastroenterology or infectious diseases, are going to be under those tabs, not here. This is just really very generic internal medicine. Okay? Now, we have selected databases. A lot of these you're going to see these as you look at textbooks because the textbooks are in many of these databases. So Harrison's is in Access Medicine. All right. ClinicalKey has a variety of other different resources in it as well. All right. So we also have videos in Access Medicine and ClinicalKey that you can utilize if you need to remember, how do I do this procedure? What do I need to ask this patient? How do I need to handle this? You can go in. A lot of them are so that you can actually click on the specific section that you want to see so you don't have to watch all 20 minutes. You may only need to see 3 of it. So those are good resources. And it shows you how it's divided up. This is videos by category. So if you're just doing patient interview or physical exam, then you can click on those resources and find what you need. ClinicalKey is a little more difficult to use when it comes to finding things that are multimedia because they are not very smart. When I was at the Medical Library Association meeting, I spent literally 45 minutes standing there complaining to them and telling them how this isn't a very user-friendly system. So there were some bigwigs there, but I haven't seen any changes that I recommended, so obviously we know how much influence I have. So if you're looking for multimedia in this, you have to, it comes up with all of these things. It comes up with everything. It comes up with all of these different categories. So if you want to end some things in internal medicine, you click on internal medicine. Then after you've done that, you click videos. And then once you've done that, it comes up with specialties under internal medicine that you can click on and narrow down. So it's a few more steps than you have to do in Access Medicine, but it's very useful as far as finding information and videos. Now, we have put on here selected guidelines for a wide variety of the internal medicine disciplines. So we have neurology. I know they're not internal medicine, but liver diseases, clinical endocrinologists, rheumatology, all of these different areas. They're all of it's a link directly to all of their guidelines. So you're able to get there very quickly instead of having to look around and try to find information. And we even have Dr. Morris's recommended website for staying on top of HCV because it changes it seemingly daily when it comes to the information about it. All right, so now this is some of the new stuff. We have a new system called Board Vitals. If you are a third year, I highly recommend that you start looking at this. Also, if you're a med student, there's a component for the USMLEs in Board Vitals. I don't have that on here, but because I'm linking just to the Board Vitals for internal medicine. So there's internal medicine itself, initial, and then there's also the MOC. So you can go in and actually test yourself. It'll keep track of what you've done, and it will tell you and recommend other areas for you to work on. It's a really nice system. All you have to do is register, and then it's set. It even has a mobile component, so So you just go to the website, adjust to your phone, and then you can do it while you're standing there waiting in line for 20 minutes to get your food. Also, we have several other things. Harrison's Principles of Internal Medicine, the 18th, not the current edition, has reviewed questions. And then this Resident Readiness Internal Medicine is brand new. And I'm not sure, I haven't looked at it very much, but it's another resource that might be beneficial to the residents. Now, as I said before, we have all of these different tabs on here that you can go ahead and click on to find additional information. All right. So even with all of this, what if you look for something for more than 10 to 20 minutes? What are you going to do? Call a friend. Well, you could call a friend, or you could call the medical librarian, because there's nothing worse. I can't tell you how many faculty I get who call me, I've been looking for this for hours, and then I can find it pretty much in 5 minutes. It's not a joke either. So try to remember, if you're looking for something, go ahead and call us. We're here to help you. All right? Now, so if you need help, let me tell you a little bit about our other librarians. Lexi Brackett's new. She's just been here a little over a year, and she's phenomenal. She's one of the writing consultants, but she also comes to Morning Report. You should have seen her several times. And then David Duggar, who also comes to Morning Report. He helps out with it. And then Monty Dobbins is the person in charge, as she calls it, the candy dish at the front desk of in the library. But she's also extremely smart and also able to help. She's over interlibrary loan, and she handles that whole entire mess, which it is. Take my word for it. So, any questions? All right? So, now that we've ended that part, where's my keyboard? Oh, there's the keyboard. Okay, so now I want to show you Visual DX, just so you all have an idea on what it looks like. All right, so I'm going to go to Internal Medicine, and I'm going to go to my selected databases, and it's not showing up here because it's under Fast Clinical Tools. All right. Oh, yes, okay. So Visual DX is pretty cool. So say you have someone who comes in with, give me something good. Okay. So psoriasis. So you click on it, and it pulls up a synopsis, the ICD-9 codes if you need it, what to look for as far as information, diagnostic pearls, any differential diagnoses that you may need. So say that there is something that could be extremely serious or very unimportant. It will tell you what to look for if those are the cases where you need to make sure you don't mess up, okay? So, and it will go through, what's nice about it is hyperlinked to all of the differentials. So you can quickly go to those differentials and rule them out if you need to. It talks about the best tests to use for any of these dermatological issues, how you manage the patients, other therapy, associated medications, and the references. The other thing it has is information for patients, which can be very useful, very quick to print and pull out. The other thing is it links to UpToDate and PubMed. So say you want to go to UpToDate to look at the latest information, that they have, you can click on that. And then if you go to PubMed, it'll pull up even more current information, which is very, very nice. The other thing that's nice about it is when you click View All Images, you can see wherever it may be showing up as far as what it looks like, okay? The other thing that you can do when you're doing Visual DX is you can put in so you say you have something that's a scaly papule. You click on that, and then it will lead you through what you need to ask or know in order to find out the information. So is it a rash or a single lesion? So we're going to say it's a single lesion. And then it's going to say up here, as you're adding to the information, what's your differential diagnosis rate? So if the diagnosis is very weak and you need to add more information, it will then, you'll need to keep putting in. So if you put in location of the finding, and you want to say you're going to put it on the legs, and you're going to put it on the lower leg. Okay? Notice how the differential strength just went up? Now if I want to decide, I want to make it a 20 to 29-year-old, it comes back and it's going to ask me, do I need to look at any of these other things? And if not, then I can just view this differential. And it will show me pictures of what it might be. It doesn't link to information, it links you directly to the pictures so that you can go, that's what my patient has. Or, I don't know, it could be this or it could be that. I need to read more. If you want to read more, then all you do is you click on the title, and then it pulls up another link to it, shows you more information, and then you can see what you would see normally if you were just looking up the disease itself. Okay? It's a pretty nifty tool. We used to have a really nifty infectious disease tool, and it never got used, so we ended up dropping it. This is a very nice tool, and I want to make sure that you, as internal medicine residents and students and faculty, know that we have this because it's, right now we want to make sure that everything is getting used as much as possible, okay, given our situations. So, does anyone have any questions about this? Does anybody want to see board vitals? What? Board vitals? Okay. They're, of course, all hating me right now. Okay, so if you go into board vitals, and you would go here, if registering for the first time, click here. Oh, this also does CME too. Almost all of our resources now do CME when it comes to the databases. So you just need to register to get them. Did I have something spelled wrong? No, I just was typing badly. Okay, so as I said, it comes up with your question banks, and it shows that I've been in family medicine and internal medicine. It also has all of these others, as I was saying. Here's the USMLEs down here. So I could go back and see my performance. And I have no performance right now because I cleared everything out because I didn't want anyone to see how pitiful I am. If you go in and you start, you would just go into internal medicine. And you can check off whatever you might want to look at. So say you want to catch up on gastroenterology. You could click that, and you could click infectious diseases. Then you just tell it how many questions you want to see, and you create the exam. So it has 50 questions that are randomly going to be gastro or infectious disease. So you're going to have your different information. It's going to show you everything you need. It's got normal lab values. All that stuff is here. What I love about this as far as a learning tool is you read this and you can guess on the answer. You can try to figure it out. But then you can go down here and click Show Explanation. And it'll tell you why something is true and then why something is false. So it helps you clarify in your mind what you need to do as far as how you may need to study. Okay? Then you can submit it for grading. You can look at it. You can pause and resume later. That's really useful when you're on the phone or on a tablet or something like that. And then it will track your timeline. It makes suggestions. And here's your CME. And it'll give you any questions that you flagged because you're not sure on the answer or you need to look up more information. It will give you, you can flag them and then you can go back to them. All right? So, and that is everything that I wanted to show you guys today. Does anybody have any other questions?
How big is the database
For Vitals? It's not as big as I would like it to be. It's not small. It's comparative to the percentage. So gastro has is a lot on the board exam, so that's got a lot more questions. Infectious disease has more questions because of that. Different areas like that. So it's comparative to that as far as percentage-wise. It's got over 1,000 questions for internal medicine. It's just, I would like to have it be 3,000 or 4,000. But they do vet every question. So they have a board that actually goes through and reads the question and determines if it's ambiguous, if it's a good question, if it's a bad question, and they vote on whether or not they're going to keep it or not. Okay? Anything else?
And to get your MOC credit, you just do that. I'm doing the board vitals, but I didn't apply for the MOC stuff.
What you have to do for that, for this board vitals, they want you to pay. So it's not free. But it does track it. So it's up to you whether or not you want to do that. I think that we get enough free from other resources that it's not really necessary. So it's up to you. I mean, what do you need here in Louisiana? 11 hours a year?
No, that's the ABIM insists on MOC.
Oh, okay. Oh, that's a whole different bag. Okay.
It's probably a cheaper MOC than what they're selling.
Yes, probably. So, so that's everything, and I appreciate your attention and all of you who came. Thank you.